Welcome everyone to this afternoon's presentation, Navigating Hearing Care and Treatment. We want to welcome our speaker, Grace Szatkowski. I'm sorry if I mispronounced that, Grace.
Oh, that was pretty
She's
good.
a PhD, she's a PhD student at Northwestern University, and I will let her further introduce herself.
Great. Thank you so much for having me. I really appreciate doing this again for everybody. So I am a licensed audiologist here in Illinois, and I am also a fellow of the American Academy of Audiology, and as well as a PhD candidate at Northwestern University. And I am studying under Dr. Pamela Souza, who does wonderful hearing aid research. And I'm very excited to be here with you all. So thank you so much for joining me today. I'm going to give you a general overview of what we're going to be talking about. So today we're going to do an overview of hearing loss. We're going to go over the different parts of the ear, some symptoms of hearing loss, as well as very briefly symptoms of tinnitus related, or you may call it tinnitus related to hearing loss. I'm going to talk about how to understand hearing loss as it is tested clinically, as well as how to interpret your hearing test. The focus of my presentation is largely going to be on hearing aids that you might get in the clinical setting with an audiologist, but I am also going to talk about over the counter hearing aids and hopefully help demystify a few things regarding over the counter hearing aids as well. I'm going to very briefly wrap up the presentation with our research at Northwestern and then provide some resources for you that I think are really, really helpful as well to remember. And also, I wanted to mention that I myself am a lifelong hearing aid user. So I'm happy to, I brought some of my old hearing aids as well as some examples here to show you all. So I'm very happy to answer any questions that you may have after the presentation. So we're going to dive right into the ear. We're looking at the main part of the outer inner ears here. The first part you see in red is going to be our outer ear. And its purpose is to just funnel sound in to the eardrum. Now, there can be causes of hearing loss that occur due to the outer ear alone. It could be an infection, a missing ear, trauma, a buildup of earwax in this area can cause hearing loss as well, known as conductive hearing loss, meaning there's a blockage and that sound cannot be conducted to go to the eardrum and up to the brain. The second part of the ear where hearing loss can occur is the middle ear. And the importance of this part is to move sound that's been funneled from the outer ear and along to the next place, which is the nerves and cells up to the brain. So it's a very important process and it has three little bones in there. This is also susceptible to damage or can be affected in a way that causes hearing loss as well. And that could be due to an infection in this area. Sometimes fluid can build up behind here, and that can block the adequate transmission of sound from getting into the nerves that we need to hear. There could be a bone dysarticulation or a muscle disorder here. And there could be even damage to the eardrum that causes issues with sound transmission as well. And usually, damage around this area is known as a mixed hearing loss, meaning there is a mix of conductive, so sound can't conduct through this area, with some involvement of nerve issues as well. So it's like two things going on at once. The final place, and really the focus of this presentation, is going to be the inner ear. So the inner ear has this lovely organ known as the cochlea here, which contains many cells and nerve endings that really help us to understand speech and get all of that beautiful information up to the brain. This is the most common area that is damaged and often results in what we consider age related hearing loss, more formally known as sensory neural hearing loss, because it's typically damage to the sensory organ of the cochlea, the cells, and the neural areas that lie within the cochlea. There's a lot of reasons why one might have a hearing loss in this area. We often associate it with aging, but it's typically from a variety of life factors, such as noise exposure, often exposure to heavy machinery, exposure to loud music can weaken the cells and the nerves that are very sensitive and located in this organ over time. Certain medications can do this as well. Overuse of aspirin, for one example, can cause deterioration of these very sensitive cells and nerves over time. And other therapies, such as chemotherapy treatments, can also be very sensitive for this area and cause damage. There are certain genetic factors, and I won't go into too much detail there, but if you have a parent or an ancestor who has had age related hearing loss, that can be passed down from family member, not always, but there is a genetic component to susceptibility to having this type of hearing loss as you get older. And then, as I mentioned very briefly, there are health factors as well. So, blood related disorders, other types of health related disorders, such as diet, lifestyle, whether you're a smoker, those can all contribute towards the cell damage, the damage of the nerve endings that may lead to a sensory neural hearing loss. So, this is the most common type of hearing loss that we often encounter. And I'm going to be focused on this type of hearing loss for my presentation today. So, we'll talk about the symptoms of hearing loss. So, you may or may not be familiar with the symptoms, and they can present themselves in a variety of ways. But these are the most common types. These are when folks usually start to notice that the hearing is not as good as they would like it to be. And the most common symptom is that speech is muffled or not clear. So it may seem like when you're talking to somebody that their voice is not loud enough, they seem like they're muffling. It could very well be that person, but oftentimes with hearing loss, that adds to that complication of hearing speech well. So it can occur often when you're listening to others. The phone and the TV are often not optimized in the way that we would love it to be able to enjoy. Hearing loss does make that harder, unfortunately. So you may notice that you might be turning up the volume for some of the electronics that you enjoy using. And it tends to be particularly difficult when listening to others, especially when there's multiple people in the conversation or when there's noise in the background, such as a busy restaurant. It can be really hard to weed out what you would like to hear when you have hearing loss. Some other things you may notice is environmental sound awareness may be challenging. You may be able to hear sirens down the street, but perhaps it is a little more difficult to tell where that siren is coming from. Think situations such as those that are not as loud, like birds chirping, rain falling, might just be harder to hear and enjoy. A big sign can also be that at the end of a conversation or the end of the day, it might feel exhausting. Technically, with a hearing loss, you are using more brain power to be able to process information that you are hearing from others to effectively fill in those blanks so that you can continue to communicate. So it is not uncommon that you might feel tired or irritable. I know when I don't wear my hearing aids, I feel very, very tired at the end of my day when I am trying to converse with others. This does not affect everybody, but some people with hearing loss may develop sensitivity to loud sounds, and it tends to happen more often, not always, but from damage to the hearing system from noise exposure and from medications. That's very common. Now, when sounds get louder, it doesn't gradually get louder with hearing loss. It gets louder very quickly, and that can be problematic. You may also experience tinnitus or tinnitus, and this can be perceived in a multitude of ways, such as ringing, buzzing, clicking sounds in the ear. It tends to be very subjective from person to person. And so I'll briefly go over tinnitus. I'm not an expert in this area per se, but I'm happy to share with you what I know right now. There's a lot of research in tinnitus, and it is often very, very closely associated to having hearing loss. Tinnitus can sometimes be that first symptom that you get when you do have some hearing loss. And it can also be due to medications or to trauma. So, trauma such as noise exposure, head trauma can cause tinnitus as well. But from what we know right now in the research, it is from damage that is in the area of the ears that we looked at previously and or along the pathway going up to the brain. There are many forms of treatment for tinnitus, especially when you have hearing loss. The most common form to help with tinnitus has been hearing aids. It tends to introduce sound that you need to hear better, and typically that can help to override those symptoms of tinnitus that you are perceiving because you're hearing sounds at a higher level again. In hearing aids, there are programs, if you're working with your audiologist, that they can add into the hearing aids, such as sounds and different treatments as well, that can be quite helpful for some people. There's also things outside of hearing aids, such as noise maskers. And essentially, these come in a variety of forms. You can find them in quite a few places, such as Amazon, Walmart, Target. You can find them quite commonly, and you will find there are quite a lot of brands. Some popular ones are on an app on your phone, and you can simply just play some really nice sounds on your phone. Like, I personally really enjoy ocean sounds when I try to go to sleep, because for me at night, my tinnitus acts up. So having soothing sounds really helps me. There are also things such as noise pillows, and those are actually speakers in your pillow that can play sounds at night for individuals that have a more severe tinnitus and might need extra sound to help them out. Essentially, when it comes to sound, I would recommend, and others have recommended this as well, to find a sound that is soothing to you and that changes over time. So typically steady sounds such as white noise, your brain can get used to it and filter it out. Not always, but you want something that's changing, like ocean sounds. Sometimes talk therapy can help as well. There's like emerging research coming out about talk therapy. The overarching framework of that is finding ways to de stress, because stress and raising your blood level can cause the sensation of tinnitus or the sounds of tinnitus to seem louder as well. So, find and things such as caffeine, salt, energy drinks, those stimulating foods can also raise your blood pressure and cause the tinnitus to sound louder as well. So, finding ways to soothe yourself, perhaps lower stimulating foods, etc., has been helpful for some people. Certain medications I won't go into too much detail about this because I'm not an expert, but some medications with talk therapy have shown some improvement, such as anti-anxiety medications, things to help relax as well. But keep in mind that some medications can make tinnitus seem louder, such as too much aspirin, etc. So now that we talked about symptoms, what you might expect, we're going to talk about how hearing loss is tested and go over how to interpret your hearing test. When you see an audiologist for the first time, the first thing you'll expect is an interview. So this is a very important time for your audiologist to understand who you are, not just as pertains to when you started losing your hearing or how long you've had it for, but how your hearing affects your life. So it's very important to share what specific scenarios you would like to hear better, and especially communication scenarios, such as with a family member. If you can bring them to this appointment, that would be excellent. So you have different points of view to bring to the appointment as well. But it's really your communication and what aspects of your life would you want to improve with your hearing is very, very critical in this appointment. The audiologist will do an ear examination. So they'll look in your ear. Typically, if there's earwax, you can get it removed at the audiologist. Not always. Some audiologists do not specialize in earwax removal. So just want to throw that out there. And then finally, the big testing portion of the appointment is called audiometry. And so audiometry includes how well you can hear soft sound. So you remember raising your hand when you hear the beep or pressing a button. And then a lot of times will also include how well you can understand soft speech and then speech at a louder level. And the purpose of this is to understand your hearing loss, but it will be used in tandem with your reports to help the audiologist understand what kind of treatment would be better for you, what kind of hearing aids might be better for you, etc. So we're going to look at what is called an audiogram. So this is going to be the printout of your hearing test results when you hear those soft beeps and you raise your hand or you push a button. So how do we interpret that? So if you look across at the top from left to right, we are looking at pitch. So kind of like a piano, we're looking from low to high pitch. And this is all in the range of human hearing that is particularly important for understanding speech. Next, if we were to look from top to bottom, we're looking at loudness. So we're going from the top, which will be very, very soft, all the way down to the bottom, which is the loudest level of hearing range. So if you look from the upper corner and you go down to the side, low pitch, low volume, and then going down, higher pitch, higher volume. Now, how do we interpret it? So it's typically classified by loudness. From negative 10 decibels to 20 or 25 decibels in some cases, this range is considered normal hearing. Below that, so remember, these are the softest levels that you can hear across these pitches. If you can only hear down to this range or up, right? We're looking at this almost upside down, but this is how we look at it in audiology. If you scored in this range, then you would be considered having some mild hearing loss because you are not able to hear speech as softly as in the normal range. And then below here in this category, up to 55 is considered more of a moderate degree of hearing. And then you can see as we go further down, the categories get more and more severe. And so this is how we classify hearing loss based on level. or loudness of how soft the listener can perceive tones from low pitches to high pitches. So next we're going to look at the important speech sounds in this range. So this is what we call a speech banana. And as you can see, even though I know it's quite busy, we are still looking at that same type of graph. So we're looking at low pitches all the way to high pitches, soft sounds all the way down to loud sounds. And so if our normal range is from here and above, we're hearing pretty well above the minimum level that we need to hear all these really tiny speech sounds. Below the level that they're on here, if you're hearing scored below all these speech sounds, that means you may not be able to hear them quite well. And so I like these little pictures because they show you what kinds of aspects in the world you will need are captured within certain pitches and loudness. So for example, water dripping is a very soft sound, but airplanes, helicopters are very loud sounds. Lawnmowers are very loud, low pitch sounds, and birds are very high pitched, soft sounds. So next, we're just going to quickly interpret a hearing test. And so I put on here some symbols and their meanings for you. So whenever we see a circle that indicates the softest sounds that the listener heard for the right ear, anything with an X will be for the left ear. These little arrows, or some cases brackets, are a different kind of test. So these are tones that are presented via a bone conduction or a headband that is worn on the back of the head. And the purpose of that is to stimulate directly that inner ear where all those cells and nerves are, and bypass that conductive component of the outer ear, the eardrum. And it can very well help us to understand what kind of hearing loss you have. So, for example, for this participant or this person, the scores for their bone or the arrows overlap with air conduction, so the right and left ears. So that tells me there's some kind of neural involvement. So it might be an inner ear hearing loss. And this kind of hearing loss where you see the overlap of all the symbols is quite common. Not necessarily always the way it slopes, but the overlap is quite common. Now, if there was a break between the two, such as the arrows were way above here, but we still had the X's and O's down below, that would suggest to me that there's an outer ear issue. Maybe there's some earwax in the way because the nerves are functioning well. I hope that makes good sense. So let's interpret this audiogram. So if we overlap our categories that we looked at, you can see that this person is outside of that normal range. And they have what we would consider a mild sloping to about a moderately severe sensory neural hearing loss. I hope that is nice and clear for you. All right. So there are other tests that we do as well following that audiogram. We do speech testing, which tests the lowest sounds that you can, the lowest level, I should say, where you can understand speech. And then also scores at the level that is loud enough for you to understand speech. Your audiologist may also do some testing in background noise, especially if you report that that is an issue for you, to understand how well can you understand speech when there's noise present as well. All All right, so now we're going to spend the rest of the presentation talking about the most common form of treatment for hearing loss, which is hearing aids. A general overview, as you may be familiar, hearing aids are useful to amplify or make sounds louder at specific sounds based on your hearing loss to help you understand speech better. They tend to be personalized based on your hearing loss with some added benefits to shape based on your lifestyle. And another important aspect of hearing loss treatment is counseling. So you might find that when you see an audiologist, you'll have certain goals that you'll want to meet. For instance, hearing the TV better, your audiologist will work with you and try to optimize your hearing aids based on how you're hearing your TV programs at home. And there are different types of hearing aids as well. So I think the muddiest part of selecting hearing aids and determining what's better for you, a lot of it has to do with the style. And there's an awful lot of styles out there. So quite a common one is called the receiver in the ear or the receiver in the canal. So that's what that C portion means. You might see this most commonly where the hearing aid sits on the back of the ear, and then there's a little tube with either a dome, or I have an example here. It has an ear mold right at the end. So it's very much able to be catered to your unique ear shape as well to try to lock as much sound in as possible. These do require some good care and maintenance, especially at the part that goes in the ear. Earwax is very commonly the reason why sound gets blocked when you're trying to listen with the hearing aid. So it does require regular maintenance. And for some people that produce more or less wax, it can be different. A slightly larger hearing aid is known as the behind the ear hearing aid. So while I showed you a receiver in the canal hearing aid that has a rather small ear mold, this one tends to be a larger ear mold and a larger hearing aid as in general. And it's usually connected to a thicker tube. These kinds of hearing aids are typically prescribed for people with more severe hearing losses because you need a lot more processing power to get into the ear. People that have had hearing loss their whole life will usually wear these kinds of hearing aids as well, but not always, but they tend to require quite a bit of processing power. And usually those smaller ones I just showed you can fit quite a variety of hearing losses from mild all the way to severe as well, because technology is emerging in such a way that we can make our hearing aids smaller and smaller. Lastly, this one is getting a little less common with time. It was quite popular about 10 years ago. It is the in the ear hearing aid. And as you can see, there are lots and lots of shapes and sizes. This was my old one. Hopefully you can see that. It's very, very, very tiny. This can be fit to a lot of hearing losses, but it does block out a lot of your ear canal when you wear it. So it does take a while to get used to it because it can be kind of bulky. It can take a while to get used to how it feels in your ear. And hopefully, as you can see, some of the buttons are quite small. So it requires some good dexterity to use these hearing aids. If they are smaller, if they are larger, like we're seeing with the man's ear on the left, that's not so bad. So those are the different kinds of hearing aids you might see in the clinical setting. I want to shift our focus to the newer classification of over-the-counter hearing aids and give an overview on what I know so far in my research, as well as what I have learned through the years since they came out. So, just a brief history: the Food and Drug Administration enforced the Over the Counter Hearing Aid Act in August of 2021 to sell hearing aids over the counter for adults with mild up to moderate hearing loss only. So, it's not meant for individuals that have a greater degree of hearing loss beyond moderate, such as a more severe loss. There are pros and cons of over the counter hearing aids. So, the biggest one is knowing your hearing loss. Do you fit within that range of mild to moderate? And what kind of sound comes out of a over the counter hearing aid can be difficult to determine, especially on your own. Over the counter hearing aids, as you will see, there are so many companies and so many different kinds. And I'm going to talk about a few examples and hopefully provide some good information on figuring out what is what a little bit better, because I know it can be quite the wild, wild west out there with over the counter hearing aids right now. Another question I often get is about warranty and repairs with over the counter hearing aids. So, when you see an audiologist, they can help you with repairs and warranty. The, the biggest difference between over the counter and getting a hearing aid from the audiologist, the biggest one is going to be cost. So, you'll find that over the counter hearing aids are a lot cheaper, and oftentimes that is because you're not paying for those services that are typically bundled into the price of seeing an audiologist regularly, who will often handle repairs and needs of your hearing aids, as well as provide you counseling and specialty services as well. Um, so, but either way, if you get an over the counter hearing aid or if you get hearing aids from an audiologist, both are classified under the Hearing Instrument Consumer Protection Act. And that is a state mandated act in the state of Illinois where you have a right to return period of 30 days on any hearing aid you buy. So if you mail order an over the counter hearing aid, you get a hearing aid from your audiologist and it's just not quite right for you, there is a 30-day right to return period no matter what hearing aid you get. So it's good to know and keep in mind, because it's not often it's that we will always know what is the right hearing aid to get, especially when you are deciding on your own and thinking about your options. Just always keep that in mind. Okay. And I would highly recommend, before you buy over the counter hearing aids, to get your hearing evaluated by an audiologist so that you have an understanding of your hearing loss. You do not have to buy hearing aids right away when you see an audiologist at all, but it is just good practice to be informed of your hearing health. And your audiologist may give you pointers as to how to manage your hearing loss that would be useful based on you and what you need as well. We don't understand the long-term benefits of over-the-counter hearing aids just yet. Too many there's not too many studies on over-the-counter hearing aids to understand how long they last. But I can tell you that with audiologist fit hearing aids, usually those hearing aids last about 5 to 7 years. However, more recently, because technology has gotten to be more waterproof, our hearing aids can last 10 years, so a little longer than they have been previously, which is great. Not quite sure what that lifespan is, at least right now, for over the counter hearing aids until we do some more research. But I want to, in our last couple of slides here, I'm going to give you a general overview of the general types of OTC hearing aids you might encounter. So here on the left is what's known as preset OTC hearing aids. And then here on the right is what's known as self-fitting. Preset OTC hearing aids can be either battery operated, so I'm not sure, I hope you can see, but this hearing aid has a little battery that's powering it that has to be changed at least once a week. Or it can be rechargeable, which is becoming more and more popular, where you do not need to change a battery. You just put it directly in the charger overnight, and it usually lasts about 24 hours a day, give or take. Preset hearing aids are not connectable to a smart device such as your phone. So if you are somebody that's on your phone a lot, or phone calls are very important to you, it may be difficult still to use those devices with preset over-the-counter hearing aids because there's usually no Bluetooth or a way to connect them to your smart device. The hearing aids typically come with buttons, like push buttons. And for these buttons, you'll just press that button to change a very small set of programs that are available in the hearing aids that are made specifically for the hearing aid. So they're not catered to you per se, but they usually contain a lower volume setting, a slightly higher volume setting if you have a little more hearing loss, and then some form of a noise reduction setting to try to help you manage talking to other people in noise. But you usually have to toggle through those settings yourself in order for them to be active. They all come with, and this is FDA mandated, a form of volume control as well. That might be a little up and down switch. It might be a wheel on the hearing aids, but they do all have that as well. So presets are basically right out of the box. They work based on settings that are already put into them. On the other hand, you have self-fitting hearing aids. So these are more so hearing aids that you program yourself. So typically with these hearing aids, they do require you to download a smart device application. And on that application, you can select certain volume levels, certain listening scenarios to build your own programs into the hearing aids up to a limited range and to save those in your device. So the con of this is that you need to own a smart device usually to be able to activate and use these kinds of hearing aids. And it does require some familiarity with what you need and how to program the devices that can be kind of complicated at first to figure out. They also all contain a manual volume control. A big difference between these two types is presets also tend to be quite a bit cheaper than self-fitting hearing aids. Presets can range from $100 to $600, and self-fitting hearing aids can range from $800 to $3,000. So it's quite a wide range of price. I'm just going to give you some examples of what these look like. So on the left, these are some examples of some currently available preset hearing aids. This one's called Neosonic. This one's called MD Volt. And this one's called Oracle. So you can see that they have that push button to change the program, and then they have a volume up down button. This one has a volume wheel, and this one has what I showed you is a volume wheel that you turn. They're quite different shapes and sizes. In general, the ones that go in your ear tend to be a little harder to manipulate and clean. So it's something that's going deep in your ear, and staying deep in your ear is going to build up more earwax than something that's sitting on top of your ear where you can change the earpiece. So keep that in mind. Usually smaller devices tend to have less, they're not able to be as loud as devices that go in your ear, but on top of your ear, but not always. So just keep that in mind as well. And then these are some examples of self-fitting hearing aids. So you can see they also come in all different shapes and sizes. A very popular one is called the Lexi Bose, which you do have to connect to a smartphone for all of these, I should say, to turn it on, program it yourself. You'll see some of them look like earbuds too, and some of them are quite big earbuds. So I would say it very, 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 very much depends on your comfort level. The ones that are like earbuds tend to be a little better managing noise than the ones that are more open and sit on top of the ear, but that's not always the case. But do be aware, when if you decide to go this route, pick this route, a big thing is going to be comfort. How comfortable are you programming the hearing aids? You have somebody that might be able to help. um, definitely reach out to any support that the company offers that you bought the hearing aids from, and think to yourself, do I want to wear something that's an earbud in my ears all day? Would that be comfortable for me? Or do I need a little more room in my ear? Maybe this would be a little bit better for me. So I hope that this helps you to see that there are different options and there are different categories. I could talk about OTCs all day, but hopefully that elucidates, demystifies some of the differences, when it comes to what's available. These last couple of slides, so I'm putting my lab in here for you if you are interested. We're always running studies. One study that we are going to be running in the future is on more over-the-counter hearing aid work. We're running other studies on how hearing loss impacts speech perception and emotion. We're also running studies on the relationship between hearing loss and memory. And I put here our lab information if you're interested. And then finally, these are some wonderful resources, and a lot of individuals I've worked with have found wonderful communities here. Northwestern has a clinic, audiology clinic, that sees a lot of patients for hearing related issues. And I highly recommend them. They do a great job and work with all kinds of hearing aids. The Hearing Loss Association of America was made for people, to come together and help each other with resources. It's run by individuals with hearing loss, and they are a wonderful organization. And then you may find that you have benefits through the state of Illinois Department of Deaf and Hard of Hearing Commission. And so I have that website here for you as well. And then finally, thank you for watching my presentation. This is my email if you have any questions, but I'm very happy to open it up to questions as well. Thank you so much.
Thank you, Grace.
Thank you.
Feel free, everyone, to unmute yourselves if you have any questions. Or you can also type your question in the chat box.
I have a question.
Yes.
Is it okay to use the over-the-counter ear drops for earwax removal? And is it okay to use it long term?
Yeah, you can definitely use over-the-counter earwax for eardrops for earwax removal. I know there's several kinds. I would say one thing about that is that sometimes those eardrops can accumulate over time. So it depends on your kind of earwax. So if you're finding that your ears are not declogging, I would see an ear, nose, and throat specialist, because some earwax is a bit harder and can be more difficult to get rid of. There is a brand called Debrox, Debrox, and it is meant to break down earwax, and then after you use it, I would recommend rinsing your ears in the shower to get that out fully. But I hope that answers your question.
Okay, anyone else?
Oh, there's one in the chat. Can an audiologist help me in choosing an over-the-counter hearing aid? That's a really good question. So, as of right now, what I know is that over-the-counter hearing aids are being integrated in some practices. At Northwestern's Center for Hearing Loss, we are starting a over-the-counter hearing aid unit. where our audiologist will start to recommend some over-the-counter hearing aids if you have a more mild case of hearing loss. Not all clinics do this, however, and it is definitely up to the audiologist if they want to dispense over-the-counter hearing aids, but it does not hurt to ask your audiologist about them. But do know that, you can very well look into it, and you're very welcome to ask any of us at our lab about them or anyone here at Northwestern, because at least from the extent of my knowledge, you're very happy to answer questions that you may have.
Any other questions? Let's see. Do you need, can you see that question? Do you need,
Oh, a referral for a hearing test. Yeah, that's a good question. So, not always. If you are on Medicare or Medicaid, I believe you still do. Um, so I would, if you are on Medicare, Medicaid, it should be quite simple. It should be quite simple to contact your primary care provider and ask for a referral. So that way, that insurance will cover it, because insurances typically do cover a hearing test. But some insurances do not require that. So I would just highly recommend check with your insurance provider just to make sure. But I believe it is still policy. At least it was when I was a Medicare, Medicaid provider, that we needed a referral from primary care before we could bill for testing.
anyone else? Okay, so if there are no further questions, just so you know, this presentation will be uploaded on our EPL YouTube channel if you would like to watch it again. And we want to thank Grace for her presentation this afternoon. Hopefully we can do this again, Grace. Maybe in person.
Absolutely. That works for me. Thank you so much for having me, and thank you everyone for being here. I appreciate it.
Thanks again, everyone. Oh, I think I have another. Oh, thank you.
Thank you.
Thanks, everyone. Have a good afternoon.